A new drug called Baxdrostat has shown promise in a recent trial. Joining us to talk more about this is Dr. Jeff Pothof, UW Health Chief Quality Officer. Now, this still needs regulatory approval, which is standard, and heart disease is the #1 killer in the world, and so lowering blood pressure is one way to avoid it. How does this drug do that? And should those of us who are on high blood pressure medication already consider switching to it if it gets that approval?
These are all excellent questions. So you're right. It still needs kind of final approval. What's interesting about Baxdrostat is it works a little bit differently than a lot of our blood pressure medications. People have heard of ACE inhibitors, lisinopril, beta blockers. This actually works on a hormone called aldosterone related to the kidney, and that modifies volume and salt. Anyways, not that important. What they did is they looked at about a couple thousand people, and they said, hey, if you have high blood pressure, defined as blood pressure between 140 and 170, that top number, and you're already on 2 medications and you're not well controlled, what happens if we put you on this medication? About 4 in 10 people who were put on that medication had at least a 10-point drop in their systolic blood pressure. So certainly not like a miracle drug, but when you're already on 2 medications and you can't get it under control, adding a third that works a little bit differently, that does help drop it some, could have meaningful differences in people who go on to develop, heart disease or strokes.
So it wouldn't be in lieu of, it would be in addition to medications that people are already taking.
Yeah, so people who are already on 2, this would be their third. So really folks who are very difficult to manage on normal medications.
Gotcha. Nearly half of all adults in the U.S. have higher than normal blood pressure, so this is significant. All right, this next one goes in the combination of ounces of prevention. Ounce of prevention is worth a pound of cure, meets vanity be damned. But some astounding numbers related to hearing aids. Addressing hearing loss early as possible significantly reduces one's chance of dementia. What's the connection?
Yeah. So we've known this for a while. So, as much as we think dementia is just kind of like, your genes, you're going to get it or you're not. We've had recent studies that say, hey, diet and exercise. This one's been known for a while. So hearing loss is actually a huge risk factor for going on to develop dementia. Now, we think it's related to not being able to understand conversations. You're more likely to be confused. You're more likely to be socially isolated because you can't hear things. This quantified it. So this looked at individuals between the ages of 60 and 70. They followed them until age 80. And if they had moderate to severe hearing loss and they had it corrected with hearing aids before the age of 70, 61% reduction in the development of dementia. Now, if you wait too long, you start after 70 with the hearing aids, don't see nearly that reduction. Here's the surprising thing. Only 17% of people who could qualify for hearing aids are using them. So to your point, maybe they don't make you cool, but if they reduce dementia by that much, certainly get your hearing tests and get your hearing aids before age 70 to get that risk reduction.
Couldn't have said it better myself. All right, one last item here. When I turned 50, my brother called and said, happy birthday, get a shingles shot, because not only are they painful, they increase your risk of heart attack. So it would seem a new study about shingles vaccine would make sense because it lowers your risk. How's that work?
Yeah. So we've had a couple studies now, and this is looking at all of them, that says, hey, if you get a shingle shot, with people are like, what are you talking about? Something painful on my skin is going to reduce my likelihood of getting a heart attack. Here's how that works. We know that a good number of heart attacks are caused because there's inflammation in the arteries that are in the heart. And we also know that when you get a case of shingles, it's pretty inflammatory to your blood vessels. So the connection is there, where if you have shingles, you've never been vaccinated against it, you get a good case of it, you actually increase your risk of heart disease. It goes without saying that if you get the vaccine and you don't get shingles, or your case is much less severe, you don't get that inflammation and you don't get heart disease. And that's what this study bore out.
Try saying get a shingles shot 5 times fast. It's hard to do, and you don't want to get it wrong.
Yeah.
Thank you as always, Dr. Pothof. We appreciate it from UW Health. Great advice.
Thank you.